From NBC News, this is Today with Campbell Brown and Lester Holt, live from Studio 1A in Rockefeller Plaza.
This morning we begin a new series we're calling About Face, How to Look Younger Without Surgery. Americans spent more than $40 billion on anti-aging products last year, and nearly 9 million people underwent age-reversing plastic surgery. But what if you could repair your skin, diminish wrinkles, even out your color without going under the knife? Well, take a look at a new laser procedure approved by the FDA called the Fraxel. Flawless complexion, smooth skin, and wrinkle-free. That's what we all dream of having. And turning back the clock, maybe a dream come true with a new laser procedure that smooths skin and evens out color. It's called the Fraxel laser treatment, and New York City dermatologist Dr. Patricia Wexler says it's the next revolution in cosmetic procedures, replacing the traditional laser peel.
The Fraxel is a laser that is recommended for anybody who's had sun damage, anybody with acne scarring, anybody with irregular pigmentation on their skin. This is different. It tightens the skin to diminish the ice-pick scars. It stimulates new collagen, so you're actually filling the scars from beneath, and it evens the pigmentation.
Dr. Wexler has performed hundreds of Fraxel procedures, including a series of 5 on 56-year-old Nadine Siegel.
I've had acne scarring. I've had that all my life. I had difficulty looking in the mirror. I averted the look. I averted my eyes.
Nadine has had other laser treatments in the past, but opted for the Fraxel because she found this treatment gave her the best results.
It looks healthy, tighter. It looks rejuvenated. You look like there's this glow.
Patients can pay up to $1,500 for the treatments. Dr. Wexler says the procedure is virtually pain-free and recovery time is almost none.
There's no removal of skin as a whole, so there's really no recuperation, so to speak.
And minutes after the treatment, Nadine will drive herself home and return to work the next day.
Dr. Wexler has enabled me to look in the mirror. I can now walk into a room with my head up. I never did before.
And Dr. Pat Wexler is a dermatologist here in New York. Nadine Siegel is one of her Fraxel patients, and they're joining us now. Good morning to both of you.
Good morning.
So Nadine, your skin looks fantastic. You must be happy, are you?
Yes, I'm very happy.
Let me throw up. I think we have some before and afters, and well, you're the after. I want to show the before picture. And Pat, just tell us a little bit, like what you were focused on.
Well, Nadine initially came in because she had acne scarring on her face and she had photo damage. There was a lackluster quality, some pitted scars, dryness, pigmentation issues.
Smoothing it all out.
Less wrinkles, less scarring. And now you can see her skin is much smoother. There's less scarring. There's a tighter jawline. And she just has overall improvement in the entire texture and quality.
And you're smiling, Nadine. But was it as advertised, the treatment? I mean, relatively pain-free? You felt like you looked okay the next day, well enough to go to work?
Absolutely.
Expensive, though.
Yes.
And
somewhat.
Somewhat. Let's talk about that a little bit, because for a lot of people, $1,500 is not going to be within reason.
Well, it's true. For some people, $1,500 won't be within reason, but it is certainly less expensive, and there's no downtime, so you're not going to miss a week of work. And there are options that you can do at home that will replace that, but the beauty of Fraxel is you're not going to risk scarring, pigmentation issues. There's 1 day of redness after the procedure, and you're going to get 85% of the result of the serious ablative procedures where it's Chernobyl, but 150% of the safety.
And you would recommend it over the traditional laser?
I actually gave away my CO2 laser after 12 years.
Wow.
Yeah.
Wow. Okay, so this is the wave of the future.
This is the wave of the future.
We do have the products here, though. If you're not quite ready to take that step, there are things on the market right now that can help you along the way, maybe not be as dramatic.
You can always try things at home first, and if they don't work, move on to other procedures.
Okay, some of the products you recommend, and there's an ingredient in them that people should look for in various products, correct?
Right. You can try a product like retinol by Rock, which has been proven to reverse photo damage and give smoother, less wrinkled, less photo damaged skin. Olay Regenerist has peptides, which are the new buzzword, which regenerates the skin and causes collagen regeneration. We also have Olay Thermal Polish, which regenerates skin and hydrates the skin.
And those are the buzzwords. When you're looking at all these products, you should think peptides, you should think
retinols, MMPI, which stops the breakdown of collagen by MMPs, which are like Pac-Man in the skin, which chew up the collagen. You think hydration, restore, regeneration, exfoliation. Those are the buzzwords you think about.
And then you, like a lot of dermatologists now, are coming out with your own line, I know, which is peels that you can do at home.
Right. And
that are powerful, like the kind we used to get in the dermatologist.
Not only are they powerful, but they're muted with products like MMPs and Niacil, which enable you to do them daily to get the end result quicker. So we have the MMPI formula and Niacil, so you can do a 10% glycolic peel on a daily basis and add...
And that's safe to do it every day?
It's safe because you've got the formulation that gives you hydration and brightening complex, and it restores the structure, the barrier structure of the skin, so you can actually do it daily.
Okay, let me end because I never want to do a skincare segment without ending on the Miracle Cream, which is sunscreen.
SPF. But what people have to know is a 15 is not a 30. 30 is really better, and you need UVA and UVB protection because UVA is present 12 months a year, even through a window. So even from a fluorescent light.
So every day, no excuses.
No excuses.
All right, Dr. Pat Wexler, it's great to have you here. Nadine Siegel, you look great. Congratulations.
Thank you so much.
And for more on the Fraxel laser treatment, log on to our website at weekendtoday.msnbc.com.